Did you know that your mouth can tell what is going on in your body without saying a word? How could that be? It's true. And we are grateful and lucky today that we have our mouth whisperer, our dental whisperer, to tell us, Dr. Claire Stagg, one of my favorite dentists in the whole wide world. And she's going to tell us how to develop some healthy oral health habits for 2025 so that we can thrive and beyond. So get your pencils, get your paper, because class is in session and we're going to learn together.
And when you need a friend, you can count on me. I'll be right here waiting for you.
Hi, my name is Lillian McDermott, and I am a certified life coach, a certified holistic cancer coach, and the host of The Classroom. If this is your first time tuning into The Classroom, please know I've been waiting for you. This is a safe place where you can go when you need a friend. It is my commitment to provide natural ways to heal, and it is my mission to make awareness, responsibility, and truth a part of our everyday life. And I hope you, my listening as well as my viewing friend, will feel empowered to embrace a new truth and live the life of your dreams. Well, as I said, it's a new year and it's a new truth. It's a new you. What can you do today when it comes to your oral health that will impact your future, that will impact your health, and it will improve it if you create some healthy habits? Well, today we have Dr. Claire Stagg, who is just amazing. By the way, if you haven't gotten this book yet, you do need to get it. It's time to smile, because your smile does show some of the things that are happening in your body. How? Well, we're going to find out today. And since it is our sole purpose in life to give and receive love and knowledge, I am grateful that Dr. Claire Stagg is here to do just that. Welcome and Happy New Year, Dr. Stagg.
Same to you, Lillian. It's such a pleasure being with you again.
It is always so much fun. Okay, so it's a new year, and some people use this time for a fresh start. So what are some of the things that we can change today, Dr. Stagg, that is going to impact our health 2025 and beyond?
So this is interesting because you know how we always have the word resolution and it's always an
That's a
overpowering.
bad word. That's a bad
I
word.
know.
Yes.
So this is, let me finish my sentence.
Yes.
So what happens is you always put so much pressure on yourself to accomplish certain things, and by the second week in January, it's a done deal, right? And I
Yeah.
like your word commitment because I think that's you commit to self. So one of the things I was reading was actually, instead of putting the pressure on to start a whole bunch of new things, what about letting go of the old that don't serve you? All right. And so one of the things you mentioned was thriving as opposed to surviving. And a lot of times, especially in this country, people rate wellness by a number. And it's not necessarily by a number, but by how you feel and how you are, both physically, emotionally, mentally, structurally, chemically, and on, emotionally, right? So that's where smile will connect all the dots. But there's a couple things that I made notes because I know that we're going to go back and
Oh,
forth, and
yeah.
it's like it's all connected, so we can't
Lead
separate.
the way. Lead the way.
But one of the things that I'd like to do is I'd like to focus on wellness. All right. The most important thing, I think, when we decide and determine between the differential between surviving and thriving is oxygen. All right. If you don't have oxygen, you're dead within 3, maybe 5 minutes. If you're a really good diver, maybe a little bit smidgen longer, but not much. So the first thing you need is going to be oxygen. And obviously, people who don't breathe properly through their noses are not going to get the nitric oxide that will keep their heart health, going well, because it gives the elasticity to their to their vessels. So you have cardiovascular diseases, you have hypertension, you have the propensity for stroke if you're not sleeping with oxygen or not getting the oxygen during sleep. And then obviously you have all that emotional stress because you're not getting that rest, you're not going into REM, therefore you're not getting that dream state, therefore you're not getting that replenishing mode for that mental acuity, that mental, right? Okay, so if you think about it, there again, we have numbers. All right, so depending on your audience, we may have a lot more adult people in the audience, but a lot of these adults have children too. So you sometimes these children are not breathing the way that they need to, and or you've had children who've died of SIDS, which may have been misdiagnosed and they probably had sleep apnea. You also have adult men who keep having to go to the bathroom several times a night. There's a hormone that's secreted because of the lack of oxygen and the tendency to try to change the chemistry in the body to make the volume and the salinity of the blood, etc., etc. Long story short, the whole gamut of gears start working just to make the heart work faster to get that oxygen going, and the kidneys come in, and basically the diabetic connection, etc., etc. So what the heck? Sleep is vital, right? And therefore oxygen is vital. That's where us dentists who do treat sleep apnea are really getting a big have a big role to play in this, because we're the only ones that actually will see those telltale signs in your mouth that a lot of ENTs don't look or know or are trained to see. And I'm just not talking ENTs, I'm talking about any doctor in general.
Yeah.
Nobody ever really looks at you anymore, just kind of or touches you. But that's what we do all day long. It's like, okay, open wide, and then we see everything. So I know
What do you physically see? What do you physically see? Because I know we did just recently last
we did.
year, we just did part one and part two on better breathing. So for those of you that have not seen that, and you can go to my YouTube channel or BitChute or Facebook, wherever it is that you prefer to watch, you can see that. But what would be a visible sign for someone to open their mouth and see that they're having a lack of oxygen? And my second question to you is, what is that hormone that is secreted when you don't have enough oxygen? I think I saw what you said.
So the naturopath, sorry, that's another thing. The NAP hormone is it's complicated. It's an acronym for many peptides or whatever. It's one that affects the way that you make. I can get back to you and let you know. It's in my book, by the way. It changes the pressure and the salinity, or the saltiness, if you will, of your blood content. And so that's what it has a cascade effect to when you're not getting the oxygen, etc. Your volume increases, so they want to go ahead and decrease the volume. And this is all your body, your brain, and your heart. And then that's where the kidneys kick in, and then you need to go bathroom. That's why kids wet their beds, by the way.
Interesting.
Bedwetting.
Bedwetting
Is
has to do
because
with breathing?
has to do with sleep apnea. Yes.
Wow.
Yeah. That's why a lot of kids, you have 13, 14-year-olds who still bedwet and they're embarrassed. And it's not because it's in the book. Yes, please go look. And all the acronyms are all there. But it is very interesting to know that you can actually change that. And it's a huge component to your psychological and emotional well-being to know, well, first of all, you're not being childish. It's grown men with prostate issues. That's another thing to, go find out if you've had a sleep test. Go have a polysomnogram. Just see if you're breathing or not, and the level of your oxygen or not. And that could help determine, your frequent bathroom steps.
What about a measurement of the oxygen level? Oximeter? Is oximeter? What is it
Oh,
called?
and a
Yes.
oximeter. Yes,
Oximeter.
you can
Okay,
do
an
that.
oximeter.
Right.
Would you be able
Mhm.
to tell with an oximeter if there's enough saturation of oxygen in your body?
You can, but the thing too is that it's a complex variable. There are many variables actually. When we look at them, you're looking at whether they're breathing or not, if they're breathing in how many stages of sleep. And the polysomnogram is in a lab, and there are 32 channels. The home sleep test that we use usually have around 6 or 7. And then we could see the variables in REM and non-REM. And you could see what we call the RDI, or respiratory disturbance index. So, for example, signs: if you have a spouse that snores, or if they thrash around, or if they have restless leg syndrome, periodic leg movements, all sorts of different things. A lot of the parents will say, my kid will be put in bed one way and wake up the total opposite, that everything's off. And so they just, first of all, it's a lot of exertion, it's a lot of energy that's dispensed. A lot of these adults, also children too, will have a propensity for diabetes, hypothyroidism,
Interesting.
strokes for adults, polycystic ovarian syndrome for women. And you ask for signs, dental and oral signs, and you can do that. You can go ahead and get a mirror. If you're at home, you can get a mirror and open it wide. And the first thing I'd recommend is lift your jowls up, literally. I mean, I had a patient that came in that had a full mouth reconstruction. All right. So you're talking about $40,000-$50,000 of all her teeth were crowned. And yet, well, and not that I'm talking badly about dental care, but it's just that when you don't know what you don't know, you don't know it until you know it. And sometimes other people, it's a little bit too late for that. But I mean, her arches were like this, her jaw joints were off, and she was a Bruxer to the nth degree. Now, remember, you heard mom say, oh, my kid, she grinds her teeth all the time. Well, there again, you might have a differential impression. They use eustachian tube, so they're actually bruxing to try to equalize that pressure, right? So you can look at the amount of extra bone that's there, because that's your body's way of compensating for the pressure. You can look in the back of your throat to see, can you see the back of your throat? Remember, we talked about that, to where
Yeah, that was
sometimes
very impressive. Yes, that you could see, and I love your little your show and tell that you had.
right. So sometimes you have little tonsils, the little ones, they're there, and then there, and there, and then afterwards you have no airway, because the tonsils, we call them meatballs. That's a stage 4, to where they're grade 3, grade 4 tonsils, to where there's no airway. Now, that to me is pretty significant for a child. So when the child goes in and you say open, and they can't open because they're what we call guarding their airway, then you have a problem. What really flabbergasts me is, like, 95% of the patients that I know or that I have will say, I don't have a problem with my airway. I breathe fine through my nose. I'm fine. I breathe fine. I don't snore. I don't make anything unless I've had a glass of wine or whatever. And then we do a 3D cone beam. And believe you, God, they have a little coffee stirrer as an airway. It's like, how do you breathe? How you can't. You could tell me you don't feel like you're not, and that's, I say, I know everybody says that.
But
Let's just see.
you sometimes we just don't know. Like when I was challenged on the show to go raw vegan for a month, after 4 days of accepting the challenge, I felt really good. But it wasn't that I felt bad. I just didn't know I could feel better. And that
Uh-huh.
is what people don't understand. That if we were to try something, just to do something different, just to see if something will improve, we just don't know what we don't know. We don't even know if those classes that we did on sleep apnea and breathing and improving your breath, those are very valuable. So I want to encourage all of you to go to,
Please do.
yeah, to go to the playlist for Dr. Claire Stagg on my YouTube channel, because they're all there. They haven't been taken down, thank God. But
So they're
yeah,
they're very well done, because you asked a lot of pertinent questions as an individual, and we really went into great detail, which all, by the way, are very demonstrated in the book,
yep,
very well demonstrated
get
with
your book.
pictures and photographs and everything. But you said something about not knowing, and also you
Yeah.
don't know that you don't feel bad, you just don't know how well you
No,
can
it's become
feel.
it's part of your life and you don't realize it.
Right. So this is what I'm trying to say, is that when we grade our society by numbers, what the American standard of care is. It's
Hmm.
basically when you have one foot in a banana peel and the other in the grave.
Yes.
And that's where people don't realize that they put up with so much, and then the day that they can't anymore. Remember, I don't know if you remember, but we talked about the adaptive range. Let's go back over that, okay? So
Yes.
you
Let's
come
go.
through the birth canal, you have a little issue. Think of goalposts, all right? Anything that's in here between the goalposts, you're fine, you're symptom free. Anything on the outside of the goalposts are all the signs of things that will say sums off, right? And it's when the dichotomy between what's happening and what you're feeling, when the barriers basically mesh and you have no longer what we would call the adaptive range. That's when you no longer are symptom free. Your signs were there all along. You had objective signs of dis-ease and dysfunction, and your body, you adapt, you adapt, you adapt, you adapt. It's like the frog in the warm water, remember? He just stays, and it's a little warmer, it's a little warmer, a little warmer until it's boiling, and then it's like, well, you're dead. So it's the same thing. If you go ahead and you adapt and you adapt and you adapt, then afterwards you're just bombarded with all sorts of ailments, and then you have to do drastic measures. Well, eating vegan may not be the solution for everybody, but lack of processed foods, stopping processed foods, stopping, and that was one of the things I was going to talk about too, is nutrition. So the same thing that if we talk about airway and sleep, you are what you put in. If you go ahead and you're eating also the right thing and you're eating clean as opposed to processed, if you can eat something, if anybody can, there's my daughter had me look at this during the Christmas break. It's a series called Lessons in Chemistry. Have you seen that? It was on Apple TV. I don't have Apple and I
No,
never watch
no,
TV,
no.
but I
Yeah.
was hooked. So it's about this chemist. And what I really liked is that she has a daughter and they go in the grocery shopping and they're looking for cereal, and then she shows her mother the box of cereal. Then I'm not saying it's Fruit Loops, but it was a cereal that had colorings in it. And the mother said, I don't know if it was polybutane or something polyphenol, whatever. It was something really technical. It was a very big, long-winded chemical name, right? And I just, it went over my head because I was trying to pay attention to the whole scene and everything. And then she looked at her and says, no, I'm not going to give my daughter cereal with jet fuel. Why would we want to eat jet fuel for breakfast? And that's it. So by law,
So it's called
the name
Lessons in Chemistry.
lessons in
Wow.
chemistry. All
And
right.
you were hooked, huh? That's
Well,
awesome.
it's but it's the whole thing, and they put the names on the labels by law, but at the same token, nobody's taken a master's of science in chemistry,
Yeah,
so
yeah.
you could be putting poison on there. America's the only continent or the country that still puts all these colorings and additives in
Oh
food.
yeah. Oh
In
yeah.
England, they're taking everything down because they're not allowed.
Yes, yes.
So
Well,
anyhow,
I don't know what the number is right now. I used to know the number, but it was like something like 1700, 2100 um uh chemicals that are banned in Europe that are not banned in the United States. That includes our makeup too. That includes and anything that touches our skin within 26 seconds and it's in our bloodstream. And we don't look at these like all these names and labels and like when you buy a banana, the ingredient is a banana. When you buy a cabbage, it's
but
cabbage. But
what's
when you,
put on the banana for it to get to you and to your table is what is different in this country or in the island when the banana tree is in your backyard or here in your backyard, you know? So it's totally different. It's a very interesting
it
concept
is, it
about,
is.
so what goes in is what you put out, right? So that would be my recommendation on wellness. It's not necessarily a number, it's how you feel. The emotional component, we talked about that. Diabetes, we talked about that. Autoimmune disorders, that was another
But how can
component.
you what can you do for your oral health that would bring down diabetes? Is
Well,
there any connection between what is the connection between diabetes and oral health other than the
so
food you're
so
eating?
Okay, so it's like the two ends to the stick. The signs of a diabetic will be seen and smelt in the mouth.
Oh, really?
And then again, because you have a clogged mouth, you're going to have lack of air, which will then predispose you to diabetes. And then because you're diabetic, then you're going to have a propensity for periodontal disease, which
Mhm.
will then be aggravated by the diabetes. So it's like a cat chasing its tail.
Okay, when we did our first summit, we were taking a picture with all the speakers. You weren't at that one. It was Dr. Levy was standing right next to me. And I had just, because I had been talking the whole entire time, I took a throat lozenge that had like a citrus kind of and it's all like an all natural kind of throat lozenge. And I had just finished having it. And by the way, we had raw vegan lunch for the VIPs. We all had that. And so I had had some of the dessert that they made, and it was all raw vegan, all healthy, no processed foods. And I was standing next to Dr. Levy, and he looks at me and he says, your breath smells sweet. You're having some gut issues." And I said, "I'm not having gut issues. I just sucked on a lozenge and I had some dessert, some raw vegan dessert." And he said, "No, the smell, I recognize the smell." So what is
Right.
that smell? You just said there's a smell. What is
So
that
it's a
smell?
ketones. It's the ketones in the breath. And another thing too is that it's a very, very distinctive diabetic
And
breath is very distinctive.
what does it smell like? If it's distinctive, can you describe it? What is it between? What is it as between a cross between this and this? What would that be?
God, I don't know how to tell you that. Coffee breath is nasty. Garlic breath is nasty.
Well, garlic breath is
It
healthy.
no, 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 no. There's a difference between fresh garlic and garlic that somebody's eaten the night before, and coffee breath and alcohol breath
Oh,
from the night
yeah,
before, you
yeah,
know?
I got it. I got it.
But
Yeah.
so I had this guy once who was doing a cleanse and he was eating cloves upon cloves upon cloves upon cloves. He was single.
Garlic? Oh
Mm.
no. I'm
I
sure there were
said,
no vampires near him.
no, but I said, there might be one. You might want to look into your singlehoodness with the amount of garlic you're eating like this. Ketones actually smell very sweet in a toxic kind of sweet way.
Hmm,
It's not a sweet like, ooh, rose sweet. It's like, like a not acidic, but not a sort of not vinegary, not alcoholy, but it's sweet. It has an
interesting.
after smell to it.
I wish there was
It's
like a
different.
little box that would say, okay, this is what this smells like.
It's not a pleasant smelling smell. Now
Okay.
remember too that on the back of your tongue you actually do have papilla, and those are what we call the volatile sulfuric compounds. So
Okay.
when your papilla, when you don't brush swipe clean, you're
Okay.
going to have all those compounds. They're going to stay in those hairy papillas, and it's going to smell too.
Okay.
All right.
S-
So we talked about focus on wellness. So weight, for example, a lot of people think, oh, new year, new me, shape. So one of the things that I think is really important, we talked about lack of processed foods. We talked about having something, what you put in, what you put out. I think what's important is to realize that that when you go ahead and you eat, if you're not well for whatever reason, you're going to carry a lot of baggage. Emotional baggage weighs a lot, not necessarily always weight. And a lot of people who come to terms with their stress and or their pain can shed this weight very easily. And again, there's a big fluctuation between the weight and the emotions and the stress, the clenching, the grinding, chicken and the egg, which ones come first, right? So, for example, in my field, when the patients have a lot of TMJ disorders, 9 times out of 10, these patients have a lot of stress. All right, so what's the stress from? Is it an emotional stress or is it a physical stress? Is it a way of letting out their trauma, their emotional trauma? Those signs are very, very visible within the mouth with very worn teeth. So, or you have the tori, so those little mushrooms at the bottom, you know. So we talked about the mushrooms on the outside, but there's the mushrooms on the inside, the big bulbous bone growths on the inside and on the roof of the mouth. You know, I've had so many patients say that, oh, my other dentist said, that's normal. It's okay. Some people have them, some people don't. Well, the reason is some people react differently and they clench and they grind because usually they're not breathing well. And so they're going to, just like the kids that clench and grind to equalize the pressure in the eustachian tube, the adults will also do that so that they'll breathe better, and or people break teeth like that too. So I think the emotional thing is very important to understand that the psychological aspect of pain is very important to understand that you have physical pain, you have emotional pain too. So that's where we come in and determine, you know, when you have patients that are told it's all in your head. Well, yeah,
Well,
it is all in your head.
well, in a way, and I want to clarify that because whenever somebody hears that, it's like, oh, it's not really happening. Physically, the pain and the emotional, and whatever's happening in the body is very real. It's
That's my
very
point.
real. But the fact that it's in your head, that's what I work with my clients all the time is how to rewrite the story. I was talking to someone today, as a matter of fact, and they were saying that the only luck they have is bad luck. And then they started telling me a story that, oh my goodness, I said to them, you've got it all wrong. This was a blessing in disguise. And all of a sudden they looked at it like, yeah. And it was all about buying something that turned out that they backed out of it. It was just the story and how they ended up where they were and all. And I thought, I would rewrite this bad luck thing that you're sending out into the universe because that was a huge stroke of luck. And so,
And everything happens
yeah,
for a reason, and things don't happen to you, they happen for
for
you.
you.
And
Yes.
so always remember the I am is very powerful,
Mhm.
very powerful, very powerful. And if you go ahead and you say, I am sick, I am not well, I am, you're actually confirming and you're stating that this is so. So I think I just had somebody last night say, there's nothing that beats gratitude. The attitude of gratitude, for example, is to
Hmm.
go ahead and to say thankful that I am well. Instead of
Yes.
saying I'm sick, you say I'm thankful I'm well. So you project that, and what you project, you attract, right?
Yes, yes,
Yeah.
yes.
So we talked a lot about structure. So we've talked in the past, you and I,
Yeah.
and about, for example, your issues with your foot and your body, and when you're not level and when you have trauma, there's always going to be that body's seeking to be balanced. Remember,
Hmm.
super, super balanced. And that's the whole health through balance. The name of the book is a play on words because we seek homeostasis. We seek homeostasis as in natural balance in our health in every which way, chemically, everything. But we also seek to be level on a geometrical slash physical plane too, right? So we talked about that. We talked about breathing. One of the couple things that I want to bring in about sleep also are the sleep aids. And one of a few things that I'm going to bring to now is sleep time. Always remember to power down. Make sure that you go to sleep if you can. I got myself some blue light glasses to try to, I mean, I thought my glasses had blue light blockers, but obviously my eyes were still getting very tired and dry. So I added that, and then drops. You can get drops. But the most important thing is to give your brain a chance to power down, say some good attitude, gratitude mantras, if you will, before bed, but to have a ritual that would help you, relax. And then talk about sleep as in bed. What kind of bed do you have? If you have GERD, why do you have GERD? What can you do to maybe get your head at a different level? Now, if you have GERD, it's because you have reflux, it's because of your airway, all right? So that's a whole different thing. You see, it's hard to disconnect anything. But so some people sleep better, should be usually on their backs because then they have an airway to breathe through. Some people sleep on their sides, which is what it is, but never sleep on your stomach if you can, because that totally distorts the angle of the neck. So that's not good. So I thought power aids, aids for power down, aids, herbal aids, tisanes, teas, tinctures, avoid alcohol before bed, because that reduces the tonicity of the muscles. Therefore, you'll have a propensity to have weak muscle tonicity. Therefore, you'll end up like snoring a lot more easily. Pillows, sometimes you want to avoid too bulky the pillow. Sometimes you want to put the pillow between your legs. Everybody's different. So we talked about that. You said something, and I wanted to come back to oral signs of of of
Heart disease,
well,
diabetes.
no, one of the things that I think as a dentist is super important, we never talked about, is your nightly ritual before bed.
Hmm.
So irrigate, floss, brush, irrigate,
We
IFBI.
did a class on that one, so just that was the title of it, right?
Irrigate, floss, brush, irrigate. So make sure you do that. And that's when too, if you don't do it properly, that's when the periodontal disease and diabetics breath, pretty close, but they're distinct. But so they're not nice, It has that sweet smell, diabetics do. So there you go. I think we've covered everything. I mean, there's so much more though, right? And the most important thing I thought, and this is what I did that helped me out, and it was the first time I've ever done this, was to actually go back and to release everything of the year before that actually alive. The first thing you do is you go ahead and you make a list of all your accomplishments. No matter how small it was, the teeniest little thing that you did that impressed you, that you persevered and that you did it. All right. And I went ahead and I thought, we're both that way. We're both type A personalities. We go, 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 go. We're moms. You're a grandma. I mean, I have like so
I'm a
many
great
people.
grandma.
All right. Well, I have three businesses at least.
Yeah.
I mean, I have books, I have patients, I have employees, I have pets.
Yeah.
And it's like we have that nurturing instinct to take care of everybody, right? So what happens is when you go ahead and you have somebody that says you need to be grateful, and then you think, well, we take for granted what we do. And I said, okay, I started. Do you know I filmed over nearly 4 pages of stuff that I was so proud that I had done, that I totally had forgotten that I had done?
Wow, that's wonderful.
Yeah,
I always encourage people to have a gratitude journal, but but it's really nice to start the year, or maybe finish the year with all the things that you've accomplished that year. And so it's nice to even start the year with that. Okay, let me look at what's ahead for us because I do not, and if anybody has followed the classroom for any amount of time, they know that I do not even use the word resolutions.
I know. That's why you.
But they say that by what, January 10th, most people are like halfway done, and it's like only the 8% of people are going to complete whatever tasks that they have in mind. So the small group that I coach before the end of the year last year, so in our month of December when we were together, we did a vision. We worked on our vision, and it was so interesting that not only did we work on our vision, but we also started looking at, okay, this is what we want. Now, how much time it's going to take you to achieve this? How, who, what, and where? How do you accomplish it? And then we created like steps and actions that they were going to do. It was amazing. People just don't know how to sit down and write their goals. And so when you sit down and you really seriously look at what have I accomplished this year, because like you, I can imagine I'm surprised it's just 3 pages. I thought it would have been this many pages, and
Well,
to
that
just
was
book alone it was such an accomplishment right
it
there.
was.
And how many pages you have? Like 1,000 pages? So
Well,
that's
I think the
no.
book itself is 315,
Yeah,
but
but
the chapter outline and then the appendix and then the preface and the foreword,
yeah.
this didn't count. So,
Yeah, but what I'm saying is that when we start looking at ourselves with that kind of value, Dr. Stagg, it is amazing what we can achieve for the next time. And so gratitude for sure is
and
it,
self-worth.
yes, yes, it is. And a lot of people don't even want to look at hard times. And I think hard times and pain and all that, they have purpose too. They have purpose too. And it's our duty and our responsibility and our honor to look at what did we gain from this pain? What did we gain from the pain? And so when we do that, we rewrite the story. Just like this
Mm.
this friend of mine that was telling me a story of her life because they had bad luck. No, that was just phenomenal luck. Why would she even look at it as bad luck? I would say it's phenomenal. So when you change the way you look at things, the things you look at change, which is one of my favorite quotes from Max Planck. And so it's very important. So when you're talking about, writing your accomplishments down, and how did that make you feel, Dr. Stagg? How did that make you
It,
feel?
it was it was it was it was very eye-opening because what I was doing is I was actually thinking of writing the office newsletter every year. I tell everybody, we're thinking of you as the year closes. Thank you for your patronage. We appreciated you. There's lots that happens behind the scenes. Here are a couple things that, and like Brittany with her little one, and then who had a baby, who got married, because not everybody comes all the time. Some people come twice a year, some people come every week, some people come more often. So it's a family letter. I actually also sent it to my family too.
Hmm.
And so I was going back and saying, ooh, I forgot about that. Ooh, I forgot about that. And then it was a busy year because I launched Smile in 2024. And I went everywhere that I could and I mean, I was walking around. I was literally walking around at every conference. Hi, I'm Dr. Stagg. Nice to meet you. This is my book. And I was talking about this, and I feel that 2025 is going to be the year because if you think about all the process and progresses that are going to be now exposed, because again, there's so much that people didn't know about, and it's like the genie's out the bottle now.
Well, let's hope so. Let's hope so.
All right.
So
And
with
so
with
this is what I'm thinking. Just rub the genie. Just rub the genie.
That's your
Just
genie.
rub the
That's
genie.
that's awesome. Well, I'm going to
Yeah.
take a little moment here to just focus on the fact that this is where we take ownership. We're learning today a little bit more about the connection between oral health with Dr. Claire Stagg. I want to encourage you to get your own copy of your book. You can go to Amazon. You can even go to her website at healthconnectionsdentistry.com, and you're welcome to look at all the other things that she has in her website. But I want to encourage you to, do whatever it takes. Go to whenyouneedafriend.com and say, I am ready to make a commitment for my health. I want to look at my oral health. I want to look at my daily habits. I want to look at whatever it is because we're going to have wonderful, wonderful classes that we're going to be benefiting from the entire year. And so let's make this an education year for you, an education of your soul, and where you can start being who you want to be. And while you're at whenyouneedafriend.com, please subscribe to the website, like and follow me on social media, share this video with everybody you know, because you know what? We all want a beautiful smile. And so how can you achieve it? Not only you listen to Classroom, you can get your own copy of your book, so you can do it yourself. Because, a lot of people say to me, well, I don't have the money. If I had the money, then maybe I would improve my smile. but what if you could do it yourself? How about if you could do it yourself? So I want to encourage all of you to get the book. Also want to encourage you to go to my sponsors page. Support my sponsors the way that they're supporting the classroom. They could be doing anything else. You get to watch this for free because they're making sure that the classroom, and for those of you who are donating to the classroom, so grateful as well. But promote our sponsors, make sure that you are helping them the way that they're helping the classroom. You can go to the Shop Now bag. In the Shop Now bag, they're all Lilly approved products. These are products that I dare put my name behind because I use them myself. Some of them are affiliates, but some of them are not. I just want you to know that these are amazing products that will help you in your goals to be as healthy or be the best you that you can be. And finally, like I said, you can help become an enrolled student in the classroom, whether it's $1 or $1,000 a month or a one-time donation. I don't care what it is. It's just you're part of being just sharing this video, making comments, putting emojis, going to Dr. Claire Stagg's a website and sharing her website for people that you know. Dr. Claire Stagg is in beautiful Florida. Yeah. And she is in Indian Harbor Beach, and it's a beautiful location. She has every single, you don't go there just for your teeth. You go there for your entire body because it's all connected. And so I want to encourage you to go to Dr. Stagg. You go to Smile Professionals, or you could go to healthconnectionsdentistry.com and you can call her at 321. If you look right behind me, all her information is here. Her website is here, and also her phone number. Her location is, 2120 Highway A1A. If you're interested in going to see her, call her at 321-777-2797. I love saying her number. And so support her the way that she is supporting the classroom. I just want to thank you, Dr. Stagg, for bringing this information. You could hoard all this information and say, no, they can come to me
No,
and they can spend all the money to get it straight from me. Or you can just continue to educate the world so that more and more people know these truths. So I want to say thank you to you for everything that you do to make sure that we know these truths, which
yeah.
is so important. So thank you. You should be very
Thank
proud of
you.
yourself
I
for
thank
that.
you for the platform because the more we share is the more people know, and prevention is worth so much more. I mean, I feel so grateful when you have parents bringing in their children, that now they're adults too, but the children come in and the parents say, I don't want my child to go through what I went through.
Yeah, yeah,
And every single one of them could thank my children because it was my firstborn who, because she fell and hit her chin, I mean, that was what I started my journey on, was because I didn't want her to be hurt or be surgically operated on when there would have been no need to, because I was able to do natural and methodical ways of preventing and healing and fixing her
yeah.
bite and her
See,
jaw
yeah.
joints.
Everything has purpose. Even
Very much
something
so.
as simple as your child falling, it gave you that pain, gave you your passion. And so
Yep.
with that in mind, we're talking about oral health, but I don't think we've ever talked about what products to use. Ever since I started going to your clinic, I've changed my toothpaste to xylitol toothpaste, my mouthwash to xylitol mouthwash. So let's talk about that kind of what should we put in our mouth to promote, healthy gums, healthy teeth. What would you say about that?
So I don't know if you're aware, but there's been this massive push now to help people understand that the fluoridating of the water is not actually a good thing. Uh, Here in Palm
I
Bay,
was
just last
so
week,
excited to see some of the exposure. This is
three
this
three
is
to
good.
two in Palm Bay, they now no longer fluoridate the water. So it'd be nice to see that happen in Melbourne too, because Melbourne covers more people.
Mhm.
So people say, well, there's no alternative to fluoride. Yes, there is. So you mentioned xylitol, but one of the things, and I don't know if you're aware of, have you ever heard of hydroxyapatites? Hydroxyapatite is it's a sort of a mortar. If you think of bricks and the mortar that you put between the bricks, well, the hydroxyapatite, just like the xylitol, has the same effect of closing those little openings that go all the way to the inside of the nerve chamber, if
And
you
it's
will.
called hydroxyapatite, like an appetite.
Apatite. No, it's Appatite.
A P
Apatite.
P A
Atite.
T
Hydroxy
I T E.
HYDROXY. Hydroxyapatite. So I'm not sure if there's two P's. I think there's two P's or one P before, but it's hydroxyapatite. Now we carry now you're gonna have fun because there's different brands. Some of them are professional grade, so therefore they have nanoparticles, which means that they're really tiny, which means they're very effective. Those companies have rinses, sprays, and one thing I discovered was floss. They actually have a floss with hydroxyapatite on them that's vegan based, which I was so excited. I jumped on and I got a bunch of them because now find out that there's issues with the Teflon coated floss, which I always was a huge proponent for because the glide, it would be a lot easier to go ahead and to remove a lot of the plaque with that. So yes, I went ahead and I invested in the hydroxyapatite floss. And that helps a lot with patients who have a lot of recession, those who clench and grind, have a lot of cervical recession on the gum line. And then I have another company that went ahead and has another hydroxyapatite. And by the way, all of them have xylitol too.
So hydroxyapatite has xylitol in it. And
No,
I'm trying to
no,
understand.
no,
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 they
no,
don't.
no, 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 no. The paste has hydroxyapatite and xylitol. It's
Yeah.
not hydroxyapatite that has xylitol in it. They're two
Oh,
different.
yeah. Okay. Yeah. The paste. Is that the one I bought?
Well, there's a brand
Made
called
with,
Risewell
that's what I
that
bought.
has
Yeah.
that has the that's the professional strength one. Then the other one, the Supermouth, has hydroxyapatite. The price differential is because one's a lot more professionally graded than the other.
Yeah.
And I am so impressed. I'm really impressed by the formulation. I was like, wow.
Good.
Yeah.
Okay. What else can we do? What can we do to bring back our gums? I know we talk about gum recession, but is there anything that we can do to naturally bring our gum from receding from recession?
Well, always go back to why are they receding and why is the recession occurring, right? Very rarely will you have a chemical component to the recession. I mean, the chemical component or the periodontal disease will act as an additional assault to think of it, gums cover bone. So if you've already lost bone, the gums are going to have receded, right? And if on top of that, you have inflammation, then what will happen is you're going to end up having a false height of your gum levels, when in reality, the bone levels are a lot lower. That's why your periodontal disease, your pockets are usually a lot higher when there's a lot more inflammation. And when you get rid of the inflammation, the pocket depths go down, but you still have the recession. Hence the need for the hydroxyapatite and all the remineralization toothpaste that, by the way, Sensodyne doesn't help with remineralization. It just numbs the nerve endings inside the little openings. It actually does not seal like the hydroxyapatite or the xylitol will. So in
Interesting.
effect, when you say how can you stop or how can you regain the bone loss, well, unfortunately with periodontal disease, once you've lost the bone, you've lost the bone, but you could stop losing more. That's the best that I can tell you, is to avoid more bone loss.
Okay, so the best way to prevent bone loss in your mouth and your jaw is fill in the blank. What is the best way that we can
So
prevent?
that would be to stop clenching and grinding. And why do you have a poor bite or poor functional habits or dysfunction? It's usually because you can't breathe well. or because the teeth aren't strategically placed. And
And
that
I
usually
know
happens because you can't breathe well, and so your jaws don't grow the right way.
I
So
know that
it's
we've got a delay. And I know that we're going to be talking about alignment in our next class because I really do want to talk about that because
so much.
you have spoken about how we don't, because of the foods that we eat, our palate doesn't, our mouth does not expand the way it should be. I was talking to my husband the other day, and this girl, we were in a cafeteria restaurant or whatever, or at the I think we were in Rhode Island, and this woman smiled, and she had the biggest, whitest smile, wide, as in wide. And I thought, Dr. Stagg would love that. She probably has the perfect expansion in her mouth and her
Yeah.
palate. So share a little bit about the good news about what you're going to be providing soon.
Oh, so one of the things that I worked on so much in 2024, I went through a pediatric sleep residency that would help us integrate an Italian aligner system that has a cranial component to it. So as you're actually developing arches, you're actually changing the cranial sutures, you're aligning that, and that's going to be huge. That's going to be huge. The system is called Nuvola. It's the only one in the world that has that cranial component, and the the piece, if you will, it's like a mouthpiece. It's called the Freedom of all things. An Italian company calls the mouthpiece Freedom, and you chew with it 30 minutes a day. Now it's very hard, so you're not chewing with it continuously 5 minutes. You can if you wanted to, but it's a myofunctional device, if you will, to where you actually can go ahead and get those muscles to work. But the piezo, the forces are distributed through the nose up to the cranium, right through the vomer. And what that does is it gets to the base of the cranium. And that's the base of the cranium, which houses the pituitary gland with the sella turcica. I mean, it's freaking amazing. It's just like, wow.
And it's like, does anybody qualify? Does everybody qualify for this? Because I know that there are people that would like to improve their smile, and they maybe they don't qualify for Invisalign or whatever that is.
But
Maybe
it,
they.
but it, so Invisalign is a brand name of aligners.
Hmm.
The Nuvola is the brand name of these aligners. All
Yes,
right.
yes.
Right. So all you would need to do really is to go through the diagnostics and figure out how and what to do. It's just like if you were to go to an orthodontist and they take records, then you would go ahead and come to us and we do records. So I can guarantee you our records are going to be a lot more detail oriented.
I can assure you of that. I
Yeah.
don't think I've ever
Because
met anyone who takes more detailed um,
yeah, it's just not teeth.
notes
The
than
teeth
you.
are the tip of the iceberg. So, I mean, if we're going to work your body through your mouth, we're going to look at your body too. I mean, my wheelhouse is from hair up. I'm not looking anything. We're taking pictures of how you line up. So, for example, if you have one shoulder higher than the other, or you have one hip higher than the
Yeah.
other, or if your shoulders rotated, or your neck, you have no range of motion, all those are telltale signs of dysfunction and structural misalignment, which can very easily come back to the unlevel bite. Now, I'm not
Amazing.
saying I will fix them by myself, but seeing them and being aware of them, I can go ahead and say, okay, this is what I can do, but this is what a chiropractor will need to help you with.
Mhm.
This is what an ENT will need to help you with, etc., etc. So this is where I think the type of dentistry that we do, whole mouth, whole body dentistry, I think it's really fascinating. We're coined, we used to be called dental physicians. There was a reason for that.
Yeah, it's amazing how dentistry has changed so much, and how you have you have hung on to the traditions of in the past, and how
We're
important
bringing it back,
dentistry was. Yeah, you're
Lily. We're
bringing it
bringing it
back.
back.
like who's that Pitbull? Bringing it back. So you're gonna be bringing it back, which is I think it's wonderful. Dr. Stagg, if anybody wants to get a hold of you, would they be able to just call and schedule an appointment with you? How does it work in your office? If you can just share a little bit about, how can someone get a hold of you? Should they email you? Is there a contact page and at healthconnectionsdentistry.com?
So there is a little section where you can go in, and we do have a little questionnaire. We want you to make sure that you know the type of practice that we are. I'm not a drill, bill, and fill practice. I spend way too much time. Well, that's Napoli said. I spend a lot more time per patient with my patients that I get to know as individuals. And the goal is to get them to see what I see and to take ownership of what's going on. So if they go ahead and they want to, they could fill out that little questionnaire, but go to the websites, Health Connections Dentistry or smileprofessionals.com. Learn a little bit more about the office, but more importantly, you'll learn about yourself when you read about the office because it's all there. And then feel free to call the office at the number you gave, 321-777-2797. And what that does is you'll have somebody that's very knowledgeable at the other end that's going to go ahead and ask you questions that will give us an idea which Dr. Stagg you want to see. Dr. Stagg, the general dentist, Dr. Stagg who does TMJ therapy, sleep apnea therapy, orthodontics, orthopedics, nutrition, airway. I mean, you name it, it's all under one roof, which is very unheard of because usually you're shipped out to different specialists every time something's off,
Well, I got the whole Swiss Army knife kind of thing. I
You
went in
did.
there, I got the whole works, and I'm so grateful that I did. So I want to thank you, Dr. Stagg. Can you believe time has just flown like it has? It's always the fastest hour or maybe 55 minutes in the internet. So I'm really excited that you have been a part of today, and I'm excited about this year, and I'm ready to thrive in 2025. Aren't you?
Awesome.
Yes. And please remember, we'll be right here waiting for you worldwide at whenyouneedafriend.com. This is Lily McDermott and Dr. Claire Stagg wishing you love, peace, joy, and unexpected abundance. Make it the best day ever. Good job. Good job.
The opinions and advice expressed on the Lillian McDermott radio show are intended for the individual callers and guests on the program and are presented to our wider audience solely for general educational purposes. Please act responsibly and consult personally with your own medical, psychological, or nutritional expert before taking any steps to improve your life.